Laparoscopic cholecystectomy is a minimally invasive surgical procedure used to remove the gallbladder. It has revolutionized the treatment of gallbladder disease, offering patients a safe and effective alternative to traditional open surgery. This comprehensive guide will walk you through the intricacies of laparoscopic cholecystectomy, providing a clear understanding of the procedure, its benefits, and what to expect during the recovery process. Gone are the days of large incisions and prolonged hospital stays. Laparoscopic cholecystectomy, often referred to as keyhole surgery, utilizes small incisions and specialized instruments to remove the gallbladder. This minimally invasive approach translates into less pain, minimal scarring, and a faster return to your daily activities. Whether you or a loved one are facing gallbladder issues, understanding the procedure can alleviate anxiety and empower you to make informed decisions about your health. We will delve into the details of the surgery, addressing common concerns and highlighting the advantages it offers. Join us as we demystify laparoscopic cholecystectomy, empowering you with the knowledge to approach this common procedure with confidence and peace of mind. Nestled beneath the liver, the gallbladder is a small, pear-shaped organ that plays a crucial role in digestion. Although small in size, its function is mighty, primarily storing and concentrating bile, a fluid produced by the liver to digest fats. Imagine your gallbladder as a reservoir, carefully storing bile until it's needed for digestion. When you consume a meal, especially one rich in fats, the gallbladder contracts, releasing bile into the small intestine. This bile acts as a detergent, breaking down fats into smaller molecules that your body can easily absorb. While the gallbladder plays a role in digestion, it is not essential for survival. The liver can still produce bile even without a gallbladder. However, the absence of the gallbladder may lead to changes in digestion, particularly in the way your body processes fats. Understanding the gallbladder's function is key to appreciating the impact of gallbladder disease and the rationale behind laparoscopic cholecystectomy as a treatment option. Gallstones, hardened deposits that form in the gallbladder, are the most common culprit behind gallbladder problems. These stones, primarily composed of cholesterol, can range in size from a grain of sand to a golf ball, and their presence can wreak havoc on your digestive system. Symptoms of gallstones can vary, with some individuals experiencing no discomfort at all. However, when gallstones obstruct the flow of bile, it can lead to excruciating pain in the upper right abdomen, often radiating to the back or shoulder. This pain, known as a gallbladder attack, is often triggered by fatty meals and can be accompanied by nausea, vomiting, and indigestion. Untreated gallstones can lead to serious complications, including inflammation of the gallbladder, cholecystitis, blockage of the bile duct, choledocholithiasis, or even inflammation of the pancreas, pancreatitis. These complications can cause severe pain, infection, and potentially life-threatening situations. Section 4. Laparoscopic cholecystectomy, a minimally invasive solution. Laparoscopic cholecystectomy stands as the gold standard for treating symptomatic gallstones, offering a minimally invasive approach that minimizes pain, scarring, and recovery time. Unlike traditional open surgery, which involves a large incision, laparoscopic cholecystectomy utilizes several small incisions, transforming the procedure into a relatively comfortable experience. During the surgery, a surgeon makes a few small incisions in the abdomen, through which specialized instruments are inserted. A laparoscope, a thin telescope-like instrument equipped with a camera, provides a magnified view of the surgical field, allowing the surgeon to visualize the gallbladder and surrounding structures. With precision and expertise, the surgeon carefully detaches the gallbladder from the liver and bile duct, removing it through one of the small incisions. The incisions are then closed with sutures or surgical staples, leaving minimal scarring. The minimally invasive nature of laparoscopic cholecystectomy translates into numerous benefits for patients. Reduced pain, minimal scarring, and a shorter hospital stay are just a few advantages of this approach. Most patients can return to their normal activities within a week, a stark contrast to the weeks or even months of recovery often required after open surgery. Section 5. Life after surgery, recovery and beyond. Following laparoscopic cholecystectomy, most patients experience a smooth and swift recovery. The minimally invasive nature of the procedure allows for a quicker return to normal activities. Understanding the post-operative recovery process is paramount for optimal healing. Immediately after surgery, you'll be closely monitored as the anesthesia wears off. Expect some discomfort at the incision sites, managed with prescribed pain medication. Gentle movement and deep breathing exercises are encouraged to promote healing. Most patients can return home the same day or the day after surgery. Gradually ease back into your routine, avoiding strenuous activities for the first week or two. Your doctor will provide specific guidelines on diet, activity, and wound care. You may experience some changes in bowel habits, such as loose stools or diarrhea. This is usually temporary, as your body adjusts to the absence of the gallbladder. Maintaining a healthy diet, rich in fiber and low in fat, can help regulate bowel movements. Follow-up appointments with your surgeon are crucial to monitor your progress. They will assess your healing and ensure a smooth transition back to your daily life.